Assalamualaikum doctors. In this video, I am discussing chest pain history. So, chest pain history, chief complaints can be difficulty breathing, dizziness or fainting, fever, occurs during physical activity, chest pain that persists. So, chest pain, our chief complaints. Analyzing the chief complaints, onset, course and duration, what make it better and what make it worse. Describe for me the pain. Is it heaviness or crushing in nature? Site and severity of the pain. Is it associated with any sweating, nausea or pallor? Is it radiated and where and any trigger? So from radiation we can understand the criteria, the diagnosis of chest pain. Sometimes first, if radiating to the jaw or left arm, that is myocardial ischemia. Chest pain radiating to the left shoulder tip, pericarditis. Chest pain associated with palpitation, that is pathological arrhythmia, supraventricular tachycardia, frequent ventricular ectopic and ventricular tachycardia. Chest pain associated with syncope, that is pathological arrhythmia or left heart obstruction, severe aortic stenosis and hypertrophic obstructive cardiomyopathy. Then superficial reproducible chest wall tenderness, that is musculoskeletal pain. Is it associated with exercise, that is myocardial ischemia, worse with the movement and deep breathing, musculoskeletal. Chest pain with cough and wheeze, respiratory causes. Chest pain with eating or posture, gastrointestinal causes. Anxiety trigger or hyperventilation, psychogenic. So we understand that from chest pain, it can be psychogenic. We will search stress in the history. Radiation if in the jaw, left arm, and with exercise, then it cardiac cause. Then shoulder tip, then it is pericarditis with L. It can be trauma related, musculoskeletal pain. Respiratory cause can be, then we can find cough and wheeze. And GIT cause, eating and posture. So we'll ask like chest pain history, is it first time or recurrent occur? Is it reducible? How is stopped and for how long it is lasting? Any other pain, any other body sites? Chronic fatigue syndrome we need to also exclude. Then about that FWASL, fever, weight, activity and sleep, any recent chest trauma or prolonged recumbency, any other concern, any chronic conditions. So this is the chest pain analysis, onset, course and duration, make it better, worse, site of the chest pain, timing, association, vomiting can be associated, respiratory cause associated, then it is radiations, very important, and also 1 to 10 how much we are giving. Then the systemic review, first of all CS, awareness of the heartbeats, fainting, bluish discoloration of the lips, any swelling in the lower limb or eyes, how many pillows using for sleep, sweating or interruption of the feeding baby. Then MSK we ask skin spots, swellings, lumps, hair and nail, pain or muscle, bone, joint and recent fracture, bluish discoloration of the gums or nail, any? These are. CNS about the headache, weakness, numbness, abnormal movement, walk, behavior, any concern about vision, hearing and speech. Chest about the cough and colds, nasal discharge, chest pain, recent bugs or chest trauma, runny nose and shortness of breathing. GIT about the tummy size, tummy pain, throwing up, oral soreness and lip cracks, anal soreness and yellow eye. Then urinary, so oral soreness, lips cracks, very important. Conjunctivitis, Kawasaki disease complication can be chest pain. We know one of the heart complication, Kawasaki disease. Urinary pee, recurrent bug, pain, color, dipstick if done, bedwetting. Blood pressure and frothy and amount. Endocrine about the thyroid, hot intolerance, diabetes mellitus, diabetes insipidus, hematology, pallor, bleeding, bruising, recurrent bug. Past history very important, 5T IOA. So trauma is very important because costochondritis. This is the main actually coming in exam. The child may be going any vacations, he played a lot or getting any trauma, traveling history, blood transfusion history, previous any surgery, previous admissions. So previous admission very important because we understand that any long-term heart condition present or not. That is one of the red flag. So asthma, acid reflux, sickle cell disease, Kawasaki disease, known any congenital heart disease, previous cardiac interventions, surgery in the past 2 weeks, which is red flag. Surgery in the past 2 weeks, we should need to exclude any fractures. Drugs are recreational substances, cocaine, oral contraceptive pills, drug-induced long QT. Then family history is very important. Consanguinity, conduction disorders, arrhythmia, long QT syndrome, Brugada syndrome, cardiomyopathy, sudden death in young relatives, age less than 40, very important. Any stressful condition in the family, last 6 months or before what happened, we ask like family member died, father unemployment, any family stressful issue, the child maybe go new school admitted, new place. So we need to identify the stress because in this age psychogenic pain, cardiac pain is more common and costochondritis another one. Then connective tissue disorders. Perinatal history plus minus puberty, vaccinations, allergy, nutrition and development, social and psychological and impact. New school, bullying issue. These are also important. So chest pain, how can we the DD? We can cardiac cause, we can keep first of all pericarditis, post pericardiotomy syndrome, then pericardial effusions, coronary artery thrombus, bacterial endocarditis. These are the cardiac cause we can keep. Myocardial ischemia, we know that congenital heart disease, severe aortic stenosis, severe pulmonary stenosis, pulmonary hypertension, coronary artery disease, congenital anomalies, post Kawasaki, previous cardiac surgery involved coronaries, cardiomyopathy, dilated hypertrophic. So in history, the child has any long-term condition, very important asking that any heart condition in the family, less than 40 years, anyone death, and previous Kawasaki, because Kawasaki complication we know. Chest causes are pleural effusion, so cough, high-grade fever, respiratory distress, pleural effusion, pneumothorax, pulmonary embolism, pneumonia, COVID, acute chest syndrome. Then musculoskeletal are very, very important, costochondritis, trauma and deformities. So remember, costochondritis, trauma and deformities. Gastrointestinal are gastroesophageal reflux disease, psychological and drugs. So this is the differential diagnosis and the chest pain. So normally come costochondritis. Costochondritis definition is that costochondritis, also known as chest wall pain syndrome or costosternal syndrome, is a benign inflammation of the upper costochondral and sternocostal joint. Risk factor is the strenuous coughing, exercise, lifting, infection of the costosternal joint. So this is all about chest pain history. Thank you.